This clip will demonstrate respiratory arrest. The patient in this particular scenario is going to be prone and not wearing any equipment. Grabbing C-spine. Hey, wake up, wake up, wake up. No response. Hey, you, go call EMS. I have an unconscious adult. And come with an AED. Look, listening, and feeling for breathing. The victim's not breathing. I have to roll the person immediately. I'm looking in the mouth, there's nothing there. Head tilt, chin lift, look, listen, and feel for 10 seconds. The victim is not breathing. I'm going to administer rescue breaths. And my breaths go in, so I administer 2. Inserting an OPA, measuring from the earlobe to the corner of the mouth, insert it inverted, and then rotate it 180 degrees. For this study, you are not using an OPA, oropharyngeal airway. Checking circulation for no longer than 10 seconds. I do feel a pulse. Victim is not breathing, so I'm going to continue with rescue breathing. 1 breath every 5 seconds. And recheck pulse every 2 minutes. After 2 minutes of rescue breathing, I'm going to recheck pulse for 10 seconds. If there is a pulse, check breathing, and if they're not breathing, continue with rescue breathing. This next scenario is going to demonstrate management of a person in respiratory arrest who is prone, wearing football equipment, and with face mask detachment tools available. Stabilize C-spine. Assess responsiveness. Hey, wake up, wake up. Wake up, wake up. No response. Hey, you, go call EMS. I have an unconscious adult. Please come back as soon as you can. I'm going to look in the airway, clear the airway, and then look, listen, and feel for breathing for 10 seconds. If the victim is not breathing, I'm going to roll right away. Immediately when they're supine, I'm going to check circulation because they have equipment on first. If there is no pulse, I'm going to access the chest right away. I do feel a pulse, so there's no need to access the chest. I'm going to look, listen, and feel for breathing for 10 seconds, and the victim is not breathing. Since there is a pulse and the victim is not breathing, I have to access the airway. Since I have face mask detachment tools available, I will use them to attempt to remove the face mask in less than 30 seconds. If this procedure takes longer than 30 seconds, initiate full equipment removal. Once I have detached the face mask, I will attempt to ventilate with rescue breaths, putting in 2 rescue breaths. It should take 1 to 2 seconds per breath, and I'm looking for chest rise. And since the breaths go in, I'm going to continue with 1 breath every 5 seconds. Here are the key points. First of all, you need to ensure that you can recognize the emergency. In this particular case, the victim did have a pulse but was not breathing. In addition, During the ventilation attempts, the breaths did elicit a chest rise, which means that there was no airway obstruction. Therefore, the person was in respiratory arrest. Rescue breathing is one breath every 5 to 6 seconds for an adult, while checking circulation every 2 minutes. Again, if airway access is possible because you have face mask detachment tools, then access the airway first to manage the situation. If you cannot remove the face mask in less than 30 seconds, then you need to initiate full helmet and shoulder pad removal in order to access the airway.